I'll be right back.
Cancer, a diagnosis that used to leave little room for hope. Since the 1800s, doctors suspected the body's immune system might hold the cure for this stubborn disease. But no one could crack the complex code until this scientist did. Now this is the new face of cancer, patients who are living proof of a cure. This is Techno, a show about innovations that can change lives. We're going to explore the intersection of hardware and humanity, and we're doing it in a unique way. This is a show about science by scientists.
Hello and welcome to Techno in Paris. I'm Dr Sharma, and we're here because of some incredible research that's helping to fight and even cure cancer. It's called immunotherapy, and it's a cancer treatment that turns the body's own cells into tumour killers. Immunotherapy is an innovative field of research, and it's changing lives all over the world. But we follow one man's amazing journey. For Techno, here's Dr Crystal Dilworth.
David White is about to do something he has done more than 120 times.
Okay, take care of the kids. I come from Anchorage, Alaska every 2 weeks.
He will leave his home in one of the most remote American cities and fly more than 5,000 kilometers to Houston, Texas.
Normal treatment, I leave catch my plane at 5 in the morning. I'm back home in 44 hours, 2 days. Still waiting? Okay.
It is a matter of life and death. David is enrolled in an experimental cancer program at MD Anderson Cancer Center in Houston, Texas. It has kept him alive well beyond the prediction his doctors once gave him.
At the beginning, you didn't think that you would be able to have such a good outcome.
You know, in the beginning, the best anybody would give me was 12 to 20 months. That didn't give you even much time to get your affairs in order. And it certainly doesn't give you time to do what you want to do with your family and children.
David has bladder cancer. He was first diagnosed in 2010 when doctors found a small tumor on the wall of his bladder.
It's pretty scary, isn't it?
Yeah, you think it's as small as less than a ping pong ball size. They cut it out and you think you're through, but you aren't. We took the serious surgery. We removed my bladder.
Did it work?
We thought so, but it didn't.
What happened?
My cancer came back in a year.
Where?
It was wrapped around my colon. I had a big tumor.
That was in 2011. David underwent chemotherapy and an experimental gene therapy treatment, but the cancer kept spreading to his left lung in 2013. Then, in June of 2013, he began the experimental immunotherapy program. Now, David is kept alive by his strong will.
I think we better start Nevo at 1:30. Yeah.
And the drug in this infusion bag. Nancy Pinkston is on the same drug. She was diagnosed with stage 3 melanoma in February 2016.
I was showering and was soaping up and thought, oh, that does not feel right. Doctor calling you at 9 o'clock at night and telling you it's melanoma. It's a game changer.
That was almost a year ago.
Great to see you again today. Your labs look perfect.
For me, I wanted to live, and I thought this was my best chance.
Nancy is also part of an experimental immunotherapy treatment at MD Anderson. She began treatments in March of 2016. She had her tumor removed surgically in May. Her oncologist is Dr. Hussein Taubi.
Were you surprised by how well the therapy worked pre-surgery?
These treatments are, absolute game changers.
And for Nancy, the change came quickly.
And I said, what do you think? You relented, you didn't want to say first, and then eventually said, I think it's a little smaller. And when I examined it, it was at least 30% smaller. And yeah, I was pretty excited.
We're all excited.
It was a fantastic moment.
I was surprised at how fast it was. I mean, after one treatment, that you would see such a big difference.
And the tumor went to pathology. There was not a single viable cell in it, not a single cancer cell in it, which is, amazing.
They did an MRI and found that there were 4 spots of melanoma on my brain.
Nancy first heard about immunotherapy when a former U.S. president announced he had melanoma that had spread to his brain and was being treated with a hard-to-pronounce drug named pembrolizumab.
I want all of you to remember that name, if you will. Pembrolizumab.
Just a few months later, President Jimmy Carter said he was cured.
When I went this week, they didn't find any cancer at all, so I have good news.
I said, how's this drug any different from what Jimmy Carter got? I just wanted to make sure I was going to get the same thing, and so he explained, for me, same drug, different manufacturer.
This new wave of cancer-fighting drugs, called immunotherapy, come in part from the lab and the brain of this scientist, Dr. James Allison, and his partner and wife, Dr. Padmanee Sharma.
Jim Allison's breakthrough actually changed the whole field. I mean, what he recognized was that the immune system doesn't just have on switches, it also has off switches. So it's the yin and the yang of the immune system. If you keep trying to turn it on, it has its own internal controls to keep it turned off. And he recognized that if you want T cells to really attack cancer, you have to turn off the off signals. So you have to block the brakes, basically. And he developed the first antibody this way, which was anti-CTLA-4, because he identified CTLA-4 as the off signal, or one of the off signals. Now we know there are so many. And by blocking CTLA-4 with an antibody, we were able to get the T cells now to go and keep killing tumor cells. And that's why some patients could have these responses. So now there's a whole field called immune checkpoint blockade, and that's immunotherapy that we know of today in the clinic.
The human immune system is built around white blood cells scientists call T cells. These molecules are so tiny, they can't be seen by the human eye. This image from an electron scan shows a healthy human T cell. When a T cell senses an infection, it will attack. But with many cancers, T cells won't attack because the tumor cells are blocking their attacking mechanism. Immunotherapy overrides those blocking systems, allowing T cells to do their job.
It's like a little war.
Yes, it is. I do think it's a war. The tumor cells and the immune system are battling, right? The tumor cells are trying to get everything to surround it, to protect it, and the immune system keeps trying to attack. And then when the tumor cells have all of the right things to protect it, the immune system is sort of disabled, and it can no longer function. And what we're trying to do is re-energize the immune system so that it can get through all the barriers that the tumor cells have put up to kill those tumor cells.
Cancer has largely been winning the immune system wars, until now.
We have clinical trials ongoing in prostate cancer, bladder cancer, kidney cancer, leukemia, AML, for example, CLL, for example, lymphomas, glioblastoma, pancreatic cancer, breast cancers, colorectal cancers, ovarian cancer.
And so what you're trying to do with each type of cancer is kind of tune that on-off for the immune system and find that right balance for that cancer type?
Exactly, and sometimes we don't find the right balance.
Sharma and Allison's lab is unique. With more than 80 human clinical trials and thousands of patients, they can test drug therapies and get immediate results from biopsies. Dr. Sharma is currently running a study on prostate cancer. So far, immunotherapy has not been effective, but there is hope.
And so we got this great immune response and lots of immune infiltrate into the prostate tumor, but we also got this inhibitory pathway. Some of these tumor cells now have all of this white staining, and the white now is PD-L1 expression.
The PD in PD-L1 stands for programmed death. It's a protein that sends instructions to the T cells to die off. Scientists call this an immune inhibitory receptor. In the tumor sample Dr. Sharma showed us, the tumor was winning the war. Immunotherapy drugs were infiltrating the tumor, but then stalled when PD-L1 was expressed. So the tumor was not shrinking, and the cancer not going away.
All of these little blue dots are individual tumor cells. And then over here on this side, like all of these colors mean the immune system's trying to fight the tumor, but the white staining here kind of tells you that the tumor's in a little ways like fighting back. It's inhibiting the response.
Exactly. So these immune checkpoint therapies are really antibodies that block these off signals. So anti-CTLA-4 was the first, then anti-PD-1, then anti-PD-L1, because these are all off signals that are now been identified in the T cells. So we think we need combination strategies for prostate cancer.
We think we've got a pretty good understanding now, for example, in prostate cancer, which has not been particularly responsive to immunotherapy. We think we've got some leads now on how to improve that, and we'll know soon. We've generated enough data to generate new trials that Dr. Sharma will lead that should answer the question. We don't know the answer yet for sure, but we've got some ideas which are based on good solid data.
And you got that data from the patient samples.
We got that data
from
the patients right here that we studied.
So your work was really instrumental in kind of elucidating those checks and balances that exist in the immune system.
Yeah. So,
and how do you get from that to a therapy?
Well, I've been fascinated, first of all, with T cells since I was an undergraduate, actually, when they were first discovered. I'm really literally that old.
What was it about them?
The whole notion you have these cells that go all over your body and protect you. I mean, it's just so cool. What astounded me, though, is I thought this might slow the tumor a little bit and we'd have to do a lot of combinations to get it to work, but it turned out in many tumors you didn't have to, just a single injection of the antibody, and that was enough.
So you and Dr. Allison are married.
Yes.
What's it like to have your spouse in the lab with you, working in the same field?
I think of myself as very lucky. Clearly I'm passionate about the work that we do. Jim and I talk about T cells more than I think any two people in the whole world. We get up in the morning talking about it, and we go to sleep talking about it. It's what drives us. Because of Jim Allison's work, we added immunotherapy as a new pillar. And immune checkpoint therapy is really what is now showing all of this benefit. We think other immunotherapy will do that as well, including adoptive T cell therapy and these other ways of engineering the T cells before giving them back to patients. You wouldn't think of chemotherapy, surgery, radiation therapy without adding in immunotherapy anymore. You've now changed that whole paradigm. Yes, I'm very proud. I think, it's his passion that I fell in love with, to be honest, and it's been his passion that drove the work. He wanted to see whether or not what he did in the laboratory, his basic science, could have clinical impact, and he drove that. I have to say, there weren't many people who thought that, oh, you're going to take an antibody and block this single molecule and you're going to treat cancer? Come on, give me a break. That's not going to work, right? He got a lot of rejections along the way, and he stuck with it, but it worked out for everyone, not just his science or his career, but it worked out for so many patients.
For some of those patients, like David White, life has been extended beyond what anyone imagined. But it comes with a price. The infusions come bi-weekly. They're paid for by the drug company sponsoring the study, but the trips are tough.
All of this is emotionally hard. I think the emotions are harder than the physical part.
So you've had some pretty amazing results on this immunotherapy. Can you tell me about that?
Yeah, you can't get luckier than I am. I got response in 6 weeks to the immune therapy, and I haven't had a reoccurrence of my cancer in 2 years.
At age 72, 2 years have made a huge difference.
Yes! Way to go, Izzy!
And what are you able to do now?
Okay, I gave up running, but I still coach and referee soccer. That's the game, guys. Thank you.
He has 2 young children who are never far from his thoughts.
It's just hard to talk about them. So when I got cancer, Nicholas was 10. Isabella was 5. It's not where you want to be with little kids. I think they're a big part of my motivation. Do I get a hug before I leave? I felt like my job wasn't done. So Nicholas is now 16, He's a junior.
No.
And Isabella's going to be 11 the end of this year, and she's a 5th grader. Big difference. I've been able to be involved and have an influence on their development in life quite a bit.
It's nice having him be my dad, and he does fun coaching things.
And with the outcomes we've got right now, I'm hopeful that it's going to be a lot longer, at least relative to this part of the disease. So I'm encouraged.
Not only did he have a complete remission where we essentially cannot find the tumor back on CT imaging, he's had a very long-term durable remission that's now ongoing for more than 2 years of treatment.
His labs and the other types of reports that you look at, do they look very similar to someone of his age that never was diagnosed with cancer?
His labs over time have become more normal, more what I've seen in the typical population. So clearly, the effects of immunotherapy are certainly relevant. They help him, he's feeling better, he's doing better, and his cancer is under control.
What percentage of the patients in your trials sort of experience this miraculous recovery?
So around 20% or so of patients do very well with these clinical trials. So it's not everyone, but it is a substantial fraction of people that we couldn't do this for before immune checkpoint therapy became available. It gives us hope that we can build on this 20% to make it 50%, 80%, maybe 100%.
I'm not going to say miracle, although it feels like a miracle. It feels like a huge blessing.
I think it is.
I think it is too.
Checkpoint inhibitor immunotherapy is just one of the new therapies. It seems to work best with cancers that people get from too much sun or from smoking. But Techno has come to Paris because of a new therapy pioneered here. It's called ACT, or Adoptive Cell Transfer Therapy. Scientists take T cells and genetically edit them. This immunotherapy has now undergone its first human test. The results are impressive. Layla Richards is only a year old, but she's fighting for her life. At just 3 months, she was diagnosed with leukemia.
We saw it as the only decision. There was no other option.
Doctors tried everything, including a bone marrow transplant.
We didn't agree with going home to do nothing. We wouldn't have tried. We didn't want no what ifs. We want to know that we've tried everything for her. Like, you can't just go home and know that there's something available and just think, what if we had tried? We've done it now, and now we know.
Layla's doctors made a desperate plea to a biotech company in Paris. It was a long shot, but Dr. André Schuliker was ready.
We got a call from the physician that we're treating, and they said we have no solution, and maybe this off-the-shelf product could be a solution. Why? Because this patient had not enough T cells.
The next step in the fight against cancer is happening in laboratories like this one. Scientists here in Paris are genetically manipulating T cells, essentially engineering them to become cancer fighters. Layla received a single dose of genetically engineered T cells.
So we shipped the vial there, and that was the first time this UCAR-T19, which is the first product for acute lymphoblastic leukemia, was dosed in this young patient.
In just a few weeks, she went into complete remission.
She's energetic, keeps us up late at night and gets us up early in the morning. And yeah, Layla's like just magic.
The genetically engineered dose is in this vial. It's a type of T cell therapy called CAR therapy, chimeric antigen receptor therapy. CARs are proteins that give T cells the ability to target tumour cells.
So, we need to get clean, I guess.
Techno was invited inside this laboratory, operated by the Selectis company, to get a close-up view of how this gene editing works. But before you enter, protective gloves and lab coats must go on.
One shoe like this. So this is the place where it's happening. It's a confined place. It's blood cells that we're being manipulating genetically to reprogram them from A to Z and to become real cancer-killing machines.
So it all happens here?
Yes.
The clean room is just the start. The entire process will take 17 days. It begins with T cells the company gets from ordinary blood donors.
So how is this different?
We call this, it's targeted therapies. Targeted because we use molecules with a kind of a warhead at the tip. These molecules have dialed in, programmed in, which are called antibodies. It's like a rocket that can recognize very specifically a cell.
So it's like a heat-seeking missile finding the cancer cells.
That's exactly it.
So we can actually see the cells being grown here in this lab?
Yes.
Can I take a look?
Our tool centered on the so-called wave room.
So here we have what's called a wave machine.
Named for the gentle motion of the machine designed to help grow the cells.
But what happened in the body is totally different. When the T cell gets inside the body, it will recognize through the chimeric antigen receptor, it will start sniffing the cancer cell, a cell that would present, for example, CD19, and then the T cell will kill the cell. But when it gets inside the body, here starts the war against cancer.
So here is where you have optimum cancer-fighting cells.
Yes, you want to preserve this cancer potential as much as possible and keep them as smoothly and nicely here, pristine of any interaction before they get into war. So here where we just make them exercise a bit, but don't exhaust them.
This is like a tumor-fighting gym.
Exactly, it's a gym.
Then it was on to the most critical step in the process.
So what's happening here?
It's where the gene editing will happen. So you load, you put the thing ready, so it's loading electricity, get started, and then the thing happened. It looks super simple
so
like this.
It happened already?
It happened. It's
very fast.
It's a microsecond.
The gene editing process happens on a microscopic level, but looks like this. So-called talons cut the DNA sequence to suppress certain surface receptors. The T cells can then be targeted for specific cancers.
So now what you have is the talons that have been pushed into the T cells with electricity, and now the action begins.
Yeah, the action is starting now, and during the next hours to 30 hours, all the gene editing will happen. Approximately over 90% of the cells will get the gene editing, not 100%.
UCART19 was used for Layla Richards, who had acute lymphoblastic leukemia, or ALL, a form of blood cancer. UCART123 targets AML, or acute myeloid leukemia, bone marrow cancer.
So what do we have here?
So these are T cells that were brought, and these cells are for targeting acute lymphoblastic leukemia. They have been just thawed, so they were frozen, and we thawed them. And so you can see the cells.
Wow, there are many cancer soldiers in there. It's amazing to think that one of these tiny little cells is a cancer fighter.
Yeah, when you see them in action, they're incredible.
The idea behind this therapy is to make it viable for any patient, because the T cells are not specific to an individual. After gene editing, there should be no rejection of those cells.
And it's so revolutionary, isn't it?
Well, we think that it's definitely a revolution that is starting. It's just the start of it in cancer, but yes, definitely it's revolutionary. Like the excitement around it is that the results seems to be very promising.
As of October 2016, Layla Richards remains in remission. A second young patient was also given the T-cell treatment. While she has not been identified, she is reportedly also in remission. But the little girl and her family, who were brave enough to risk it all and put this treatment to its first human test, is the one who Dr. Schuliker remembers with special fondness.
I'm very happy because that means that she can come home now and play with me.
What was that like to be part of that?
First time I saw her on TV, I think that this has drawn a pretty strong emotion in me, and I say, whoa, this is the most beautiful thing I've ever done in my life. And if it has to stop here, well, at least I've done something.
So what next? the innovation needs to be tested, but scientists here are confident that when it is, a cancer cure could be a reality. For Techno, I'm Dr. Shini Somara in Paris. See you next time.